Dr. Padmanabhan, thank you for joining us today. How has your practice been affected by the pandemic?
So, when you go from a specialty surgical service where you're providing both clinical care and surgical care to a point where you can't really do either in person, obviously it has makes great change. We've really tried to do as much telemedicine as possible as far as trying to meet the patient's needs, especially for the chronic issues, but even kidney stones and things of that sort. And then, of course, we've put most of the surgeries on hold. So those are sort of the big changes it's made to my office. And of course, if you just look at the overall office staff, there's been a huge reduction in the number of people that are actually in the office. There's only those people that are absolutely essential in seeing patients that are sort of emergent or really need to be seen in person.
So what types of care are you currently providing, and then what procedures have been put on hold for the time being?
So, do you mean in person?
Yes,
What? Right. So,
and telemedicine, I guess, as well, like appointments you're doing that way.
we have offered telemedicine visits to every single patient that I had on the list. And some of it is up to them. I mean, there are some patients that really feel strongly they want to see the doctor in person. Most of them are interested in the concept of telemedicine, and once they do it once, on the follow-up, they're much more amenable to doing it. But all of what I do, I'm a female urologist, and I focus on avoiding dysfunction and reconstructive issues. So many of the discussions about symptomatology and course of disease and treatment options, and at least first line and second line options, can be done easily with telemedicine. And so I've been doing that. Surgeries, pretty much everything that I do is elective, so has been put on hold. Of course, if you're the doctor on call, which I have not yet been, I will be in May for a couple weeks, then you do have to do the stents and do sort of the emergent things that come up in urology. But that hasn't been me yet.
Have you been called upon to assist in the care of patients with COVID-19?
I had to provide sort of my credentials, both ID and things of that sort, so they can make sure I'm covered. I've been told, obviously, that if they need someone, I would be called in to be first line. Right now, I'm just seeing those patients coming to clinic that need to be seen.
So how's the transition been for providing more telemedicine services for your patients gone for you?
Initially, I was a little bit worried, but with the government lifting the restrictions on telemedicine and making it such that it doesn't have to be an actual telemedicine platform, as a private group, we very quickly utilized anything we could, whether it be Zoom or FaceTime or Skype or whatever would work for them. At the Beaumont level, at the institutional level, we've been using Haiku, which is a telemedicine platform. Initially, again, for a week or so, it took a little while to get adjusted for everybody, both the IT people, the doctors, the patients, but it's fairly fluid and seamless now. I would say the biggest fear is always that for the patient and for us is that the older a person is, the more challenged they would be with technology. But most of the same group have grandchildren, and that means they want to stay in touch with their grandchildren. So most of them have adapted to the use of at least the social media type apps, and that's made it a lot easier. So in that way, I think that we have made huge advances. Telemedicine is something that I just had a discussion with someone. Venture capital firms had put a lot of money into the research of telemedicine and advancement of telemedicine, but only less than 15% of physicians are actually using it. And that was because of the limitations of cost. It was cumbersome, the platforms themselves, and not being quite sure about the reimbursement. But just by nature of this pandemic, while it has had some horrible effects globally, it's been kind of a silver lining in regards to application for specialty care. So what it's really done is it's allowed us to do almost a large pilot on how telemedicine would work in a large group. So I think coming out of it, we might gain some real functional guidelines that would help us and utilizing it in the future. So I think it's been very good for me in reaching patients that normally I would have difficulty reaching.
How concerned have you been about the safety of your family, and what precautions are you taking to protect them as well as yourself?
I am concerned. My parents I had seen before spring break, and I pretty much said I would not see them again until after I could be sure that I wasn't putting them at risk. So what I do is when I come home, I pretty much whatever, I stick with only scrubs now. And I basically take scrubs off inside out. They're left in the garage and put straight in the washing machine. Those shoes stay in the garage. I take a shower if I'm going in and seeing patients. So I am concerned. I'm definitely, there's a lot more wiping down of the kitchen and any surfaces anyone touches on our home, and everyone has to wash their hands gazillions of times. So I'm concerned and doing the best I can to try to prevent spread. And everyone's trying not to touch their face, which is hugely difficult.
What is the availability of PPE like in your area?
So we have been able mostly to keep up with the need. Beaumont has been heavily hit. There are a lot of cases, and something like over 3,000 health workers have been infected. But I think the administration is doing the best they can in providing the things that are needed. There has been some nice sterilization techniques put in place so that the N95 masks, after 2 to 3 times of use, can be dropped off, sterilized, and then picked up. And so that's a nice thing that's in place.
How have you been staying connected with colleagues? And also, what have you been hearing from other urologists in your area as well as across the country?
So it's been a very interesting time of I've actually been more, and I feel like more correspondence by Zoom or other methods, seeing and talking to colleagues across the country than I ever have before. I have seen people I usually only see once a year. I've seen them, I think, 5 times on Zoom in the last 1 month. So in that way, I'm probably staying more in touch because why just talk on the phone when you can look at someone's face? A lot of our grand rounds, a lot of the teaching that has gone on more at an institutional level now through Twitter and through other modes, people are sharing, which is great. They're sharing their lectures, they're sharing podcasts, they're sharing anything they can that might be of benefit to others in our arena. So that's been really nice. I think we're being more democratic about our knowledge, which is good.